Thanks for joining us today. Welcome to the Center for States video series on implementation planning and capacity building. This series is produced by the Capacity Building Center for States and funded by the Children's Bureau. The Implementation Planning and Capacity Building Brief is intended to help child welfare agency leaders, managers, and stakeholders take a structured approach to planning the implementation of an activity, program, or intervention to address a problem or need, and consider strategies to building agency capacity to implement it. It does this by providing step-by-step guidance to prepare for implementation, make a plan for addressing any gaps in capacity or capitalizing on strengths, and then develop a plan for implementation that includes the actions needed to get ready, actions needed to implement, and actions to measure implementation progress. Implementation planning and capacity building is broken down into 3 parts and 8 essential functions or steps that may be presented linearly, but they often overlap, and teams will loop back and forth between them. At this point, teams should have outlined the elements to include in their plan, identify the sources to pull the information from, and considered the context and how it may impact implementation, and then revisited their teaming and leadership structure. In this module, we will look at reviewing readiness assessment findings, the 3rd step in implementation planning and capacity building, and the first piece of planning for capacity building, before we move on to developing strategies to address capacity and motivation. And then finishing up with part 3, development of the implementation plan, which includes building the work plan activities to prepare, roll out and measure the intervention, activities to communicate and engage stakeholders, and then consolidating and reviewing the plan as needed. Let's get started. Why should teams review their readiness assessment findings when planning for capacity building? To identify strengths to build on and areas to be developed so that an agency is willing and able to implement the new program. To prioritize those areas of need and develop a plan to build capacity in the most critical areas for implementation of the specific program or intervention. And to effectively target resources toward capacity building in areas of need that will support successful implementation. To inform planning, team members should review findings of prior readiness assessments. If teams have not yet assessed readiness, they should do so before continuing with implementation planning and capacity building tasks, so that they can target efforts where they are most needed. Teams should review assessment findings in 3 key areas: general and intervention-specific capacity needs, gaps in motivation, and strengths to build on. It's important to remember, as teams look at needs and gaps, that capacity building is a dynamic process, and some areas may need to be developed over time. Teams will need to consider the time they have and available resources as they prioritize which needs and gaps are critical to implementation success, and how they might continue to stage capacity building over time. Let's look more in depth at each of these key areas. Intervention and specific and general capacity needs. Teams should look most closely at the areas of organizational readiness that are clearly linked to implementation success in the research, where there are gaps or insufficient areas of need in the organization or system, and those that are likely to severely limit the agency's ability to implement the new intervention if not strengthened. Teams may find general needs that affect the organization's overall health and functioning, for example, the needs for an effective human resources system to recruit staff, and intervention-specific needs that will affect its ability to implement the specific intervention. For example, needs for processes to recruit staff with expertise in family group decision-making. Gaps in motivation. Teams should carefully consider any findings about the organization's motivation. Looking for any potential incentives for staff or other stakeholder groups that would help support intervention implementation, or disincentives that would make implementation more difficult. For example, an agency may find that there are some frontline staff and supervisors who are champions for the new intervention, as they believe that it's a better fit for the agency and families than the current program or other alternatives. This motivation can help support successful implementation. On the other hand, teams may find that there are perceptions that the intervention does not fit with staff values or is difficult to implement, leading to findings that frontline workers lack a buy-in for the intervention, which could pose challenges to the initiative's success. Another possible scenario is the need for addressing motivation in targeted areas. For example, if there are some regions or counties where the gap in motivation is more of a priority. Strengths to build on. While most capacity building activities will focus on the organization's needs, it is also important to look at existing strengths that can be leveraged to further build capacity. When reviewing readiness assessments and planning for capacity building, teams should consider potential challenges and barriers that may directly affect implementation, and what strengths or capacities the organization has access to that may help them strengthen them. Some barriers may require that the implementation efforts are put on hold until they are addressed, but others may be able to draw from strengths in other areas to allow implementation efforts to move forward, and some strengths will simply help the agency achieve more successful implementation. Let's consider some examples to illustrate this. If an agency lacks a functioning data collection and analysis system, it will have difficulties moving forward with implementation tasks that require data to inform decision-making, assess implementation fidelity, or monitor results. This barrier may put implementation of a new intervention on hold while the agency builds data capabilities. In other instances, agencies may have gaps but are still able to start implementation activities by using creative solutions, such as external partnerships, and simultaneously building internal capacity. For instance, while an agency may lack a strong training system, it may be able to bring in external trainers to train staff on a particular program, and at the same time begin building their internal knowledge and skills on the training model. Strengths are areas that an agency can capitalize on to carry them through a successful implementation. For example, program champions that can influence motivation and buy-in for the intervention with staff, members of the target population, and other key stakeholder groups. What helps teams when they're reviewing readiness findings? Existing readiness findings are a good resource for teams to review, including overall readiness assessments and, in particular, intervention-specific readiness assessments. If the agency has not completed any assessments, it may want to consider reviewing the Change in Implementation in Practice series of resources on readiness. Teams should identify gaps and needs as well as strengths that may support the agency in other areas, such as champions who can increase motivation, or strong data and evaluation partnerships. And teams should spend some time strategizing on what gaps or needs are absolutely critical to early implementation efforts, and which may be built over time. Potential red flags will need to be addressed on a case-by-case basis. For example, initial training on a new practice model may be a more critical priority if there is limited capacity in early implementation, versus establishing a new coaching process that will reinforce learning over time. In Module 3 of our series on readiness, we discussed an example from the Washoe Family Search and Engagement Program Manual of 2016 on assessing readiness. Let's check back in with that example to review their key readiness findings for implementation planning. Results of the readiness survey showed that Washoe County Child Welfare Agency and the contracted service provider had the organizational and staff capacity to implement the selected intervention. They identified additional strengths in existing organizational mechanisms and supports that would help ensure implementation with fidelity to the program model and best practice standards, including team meetings, weekly case staffing with a supervisor, practice standards, fidelity assessments, feedback, coaching, and technical assistance, routine quality assurance checks, and ongoing monitoring by the project implementation and management teams. Besides these specific supports and organizational mechanisms to implement the intervention, the partner service provider had dedicated staff already familiar with the agency's practices and policies, and the system's climate was supportive of the project. The agency also had support from the state child welfare leadership, key stakeholders were involved, and there were strong public-private partnerships to support the services to be implemented. To prepare for implementation, the agency organized their next steps, including the tasks that needed to occur, the products and tools that would need to be developed to support implementation, and the system changes that would need to take place before implementation activities could begin. It sounds like the county has identified gaps and next steps to include in their plan, as well as the potential strength that could support implementation efforts. Let's take a moment to check in on what you've learned about reviewing readiness assessment findings. Why do teams review readiness assessment findings? To identify strengths, prioritize critical areas of need, and target resources toward areas that will support implementation. How do teams review readiness assessment findings? By focusing on 3 key readiness areas to address in implementation planning: general and intervention-specific capacity needs, gaps in motivation, and strengths to build on. What can help teams review readiness assessment findings? By using existing findings when possible, identifying gaps and strengths, and prioritizing critical implementation needs. Now take this a step further by reviewing the reflection questions for review readiness assessment findings in your implementation planning and capacity building workbook to connect what you've learned to your own experience. Up next is develop strategies to build capacity, the 5th module in this series and part of the 4th function in implementation planning and capacity building.
This video was created by the Capacity Building Center for States, funded by the U.S. Department of Health and Human Services, Administration for Children and Families, Children's Bureau, under contract HHS P2332014000033C. The content of this video does not necessarily reflect the official views of the Children's Bureau.